Hello, and welcome back to Vitality 50 Plus podcast. I'm Dr. Jennifer, and today we're tackling a topic that most men over 60 avoid discussing, even with their doctors. We're talking about prostate health and how your private health habits might be helping or hurting you. Now, I know this might feel a little uncomfortable at first, but trust me, by the end of this conversation, you'll have science-backed information that could literally protect your long-term health and vitality. So let me start with something really important that every man over 60 needs to understand. Your prostate isn't the same organ it was 30 years ago. It's been changing, growing, and responding to hormonal shifts this entire time. By age 60, about half of all men experience some degree of prostate enlargement, and we call this benign prostatic hyperplasia, or BPH. By 70, that number jumps to around 70%. Now, what most men don't realize, and this is fascinating, is that maintaining regular private health habits, when done correctly, actually protects your prostate. It's not something to feel guilty about or ashamed of. It's actually health maintenance, just like exercise or eating well. But there are 4 critical mistakes I see men making repeatedly, and these mistakes can lead to inflammation, infection, and even increase the risk of prostate complications. So, let's dive into these mistakes and, more importantly, how to avoid them. Yet so many men approach their personal wellness routine the same way they always have, or they actually become more aggressive because they think they need more stimulation to achieve results. This is really dangerous thinking, and let me explain why. Excessive pressure can cause micro tears in the tissue, bleeding around the prostate, and even set the stage for infections. If you already have some natural inflammation from aging, which most men do, adding rough handling is like repeatedly pressing on a bruise. It makes everything worse. What you need instead is a gentler, more mindful approach. Think therapeutic massage, not pressure. Mistake number 2, and this might surprise you, is going to extremes in either direction with frequency. Some men over 60 dramatically reduce their private health activity or stop altogether, thinking it's just part of getting older or feeling embarrassed about changes in their body. Others go the opposite way and engage compulsively, thinking more is always better. Both approaches are problematic for your prostate health. Here's what the research actually shows, and this is absolutely fascinating. Large-scale studies involving nearly 30,000 men found that regular release can reduce prostate cancer risk by up to 31%. Men who maintained frequency between 4 to 7 times per week had significantly lower rates of prostate issues before age 70. Now, why does this happen? Well, your prostate constantly produces fluid, about 1 milliliter every single day. When that fluid isn't regularly cleared out, it can stagnate, allowing inflammatory compounds and potentially harmful substances to accumulate in the gland. Think of it like a plumbing system in your house. If water sits in the pipes too long without flowing, it can develop problems, right? Bacteria grows, things get stagnant. But when you keep things moving regularly, everything stays cleaner and healthier. So regular, consistent activity is actually preventative maintenance for your prostate. Not compulsive behavior, mind you, but routine care, like taking your vitamins or going for daily walks. It's that simple. Now, mistake number 3 is about the products you're using during your private time, and I cannot stress this enough, gentlemen. Please do not use hand lotion, petroleum jelly, soap, or cooking oil. I know it seems convenient, whatever's in the bathroom cabinet, but your urethra and the delicate tissues around your prostate were not designed to handle these substances. Petroleum-based products can trap bacteria and create the perfect breeding ground for infections that can travel up to your prostate. Lotions with fragrances contain chemicals that irritate sensitive tissues and disrupt your natural pH balance. Soap actually dries out the area and can cause tiny tears that invite infection. And household oils, well, they can go rancid and develop bacteria. The solution is straightforward. Use water-based or silicone-based personal lubricants that are specifically designed for body-safe use. Yes, it means making an actual purchase at the pharmacy or online, and I know that might feel awkward, but your prostate health is absolutely worth it. These products are pH balanced, they don't harbor bacteria, and they're formulated to be safe for your most sensitive tissues. Most stores now have self-checkout if you prefer privacy, or you can order online discreetly. And while we're on this topic, please avoid using household objects that weren't designed for personal wellness purposes. Emergency rooms see thousands of men every year with serious injuries from improvised items, everything from vegetables to random household objects. These can cause tears, infections, or require emergency surgery. Stick to body-safe products with proper design features if you're exploring any kind of wellness routine. Mistake number 4, and this is perhaps the most dangerous of all, is ignoring your body's warning signals. Pain during release is never normal, regardless of your age. Blood in your semen or urine isn't something to wait and see about. Significant changes in volume, force, or consistency aren't just minor inconveniences to shrug off. These are your body's way of communicating that something needs medical attention. Too many men have been conditioned to tough it out or assume discomfort is just part of aging. But painful experiences could indicate prostatitis, which is inflammation of the prostate, or infection, both very treatable when caught early. Blood in your semen might be something minor, like a burst blood vessel, but it could also signal infection, significant enlargement, or other conditions that require medical evaluation. Changes in your patterns can reveal a lot about what's happening with your prostate health, and these shouldn't be dismissed. The key is distinguishing between normal age-related changes and actual warning signs that require professional attention. If you're experiencing concerning symptoms, please have a conversation with your doctor. Don't suffer in silence because of embarrassment. Your doctor has heard it all before, trust me, and they need accurate information to help you maintain your health. If your doctor seems uncomfortable discussing these topics, it might be time to find a healthcare provider who takes a more comprehensive approach to men's wellness. Now, let me share some practical guidance for maintaining optimal prostate health through your 60s and beyond. First, aim for regular activity, ideally 4 to 7 times per week if possible. This isn't a performance requirement or something to stress about. It's simply a health recommendation based on solid research. When you do engage in your private wellness routine, be gentle and patient with yourself. Always use appropriate body-safe lubrication every single time. Take your time and pay close attention to your comfort level throughout. If something hurts or feels wrong, stop immediately. That's your body giving you important feedback. Also, consider your positioning. Many men find that lying on their back with proper pillow support reduces strain on the pelvic floor muscles. If you have back issues, try lying on your side with a pillow between your knees. The goal is finding what works for your body without causing strain or discomfort. There's no one-size-fits-all approach here. Think about your overall lifestyle, too, because prostate health doesn't exist in isolation. A Mediterranean-style diet, rich in colorful fruits, vegetables, and healthy fats, benefits prostate health tremendously. Foods like tomatoes, which contain lycopene, a powerful antioxidant, and green tea with its catechins have shown particular promise in research for prostate protection. Fatty fish, like salmon and mackerel, provide omega-3 fatty acids that reduce inflammation throughout your body, including in your prostate. Regular cardiovascular exercise improves blood circulation to your entire pelvic region, which keeps tissues healthy and oxygenated. Just avoid long periods sitting on hard surfaces like bicycle seats, which can put unnecessary pressure on your prostate. Maintain a healthy weight because excess pounds, especially around the midsection, put additional pressure on your pelvic area and can worsen prostate symptoms. And prioritize quality sleep, 7 to 9 hours in a dark, cool room, because poor sleep increases inflammation throughout your body, including in your prostate gland. Also, consider natural supplements that support prostate health. Saw palmetto has been studied for BPH symptoms. Zinc is crucial for prostate function. Vitamin D plays a role in reducing inflammation. And pumpkin seed extract has shown promise in research. But please, before adding any supplements, especially if you're taking medications, consult with your healthcare provider to ensure safety and avoid interactions. Medical disclaimer here, and this is important. If you're experiencing any symptoms like pain, bleeding, difficulty urinating, weak urine stream, frequent nighttime urination, or significant changes in your function, please consult with your healthcare provider for proper evaluation and treatment. The information I'm sharing today is educational and should not replace professional medical advice tailored to your specific situation. Here's what I want you to remember, and this is crucial. Your prostate has been working for you for over 60 years, day in and day out. Now it's time to return the favor by taking proper care of it. Personal wellness and desire are completely normal and healthy at any age. Don't let anyone tell you otherwise. The men who maintain the best prostate health as they age are those who adapt their approach rather than give up entirely. They adjust their techniques to match their changing body, they maintain regular healthy habits, and they aren't afraid to seek help when needed. Your golden years can truly be golden when it comes to both prostate health and personal satisfaction. With gentle techniques, appropriate body-safe products, attention to your body's signals, and a healthy lifestyle, you can protect your prostate and enjoy vitality for many years ahead. This isn't about giving up anything, it's about doing things smarter and safer. Don't let embarrassment prevent you from taking care of your health. Have those important conversations with your doctor about prostate screenings, PSA tests, and any symptoms you're experiencing. Make the necessary adjustments in your routine. Invest in proper products. And remember, it's never too late to start taking better care of yourself. Small changes today can make a tremendous difference in your quality of life tomorrow. Thank you so much for joining me today on this important topic. I know it's not the easiest subject to discuss, but it's one that affects millions of men and deserves open, honest conversation. If you found this helpful, please share it with another man who might benefit from this information. We need to normalize these discussions and help each other stay healthy. Until next time, this is Dr. Jennifer reminding you that your health matters at every age, and taking care of your prostate is taking care of your future. Stay vital, stay informed, and take care of yourself, gentlemen.